The journey from an invention to patients is a long one. It takes many years before you actually enter clinical trials. And the clinical trials are there to establish that it's safe and that it's effective. Now, so there are different stages in clinical trials. The first stage is that you try and establish that dose, how much you give, how often. Do you give this medicine once a day or twice a day? Why is it that some medicines are difficult to take? Well, it's because we can't change the properties of these molecules. So we have to find that out in phase 0, we used to call it. Then we move into testing this in human beings. And the first phase is actually doing that in young men. And it's not that we are discriminatory in any way, but it's felt that it's better to give it to young men because you never know if a young woman is pregnant and you don't want to take any risks. Then once you've established that it's safe to continue, then you start giving it to patients. And that's when you enter phase 2 of the clinical trials. You probably take patients that are very ill or they've tried many other drugs before that didn't work. And you also try different doses. These phase 2 trials are sophisticated. They require high-tech investments. It's only the best university hospitals in the world that can do this. This is an area where Europe is very good in competing, by the way. Once you've left phase 2, you go into the phase 3, which is the big investment, both in terms of time and in terms of money, because that's when you test whether this works in a much bigger population. Phase 3 trials could have thousands of patients. So in order to get, for instance, 10,000 patients, you may have to include both the US and Europe and Asia in the trial. You have to have a standardized testing regime. We call it the protocol. This is a test plan that has to be implemented everywhere. Everyone has to be prepared. Everyone has to have the right equipment. I think you can understand that this is quite a significant project that you undertake. Increasingly, we do studies later as well. So after this phase 3 trial I mentioned, you will get your approval from the regulatory authorities. Here in Europe, it's the European Medicines Agency in London. But after that, we do follow-up studies. We call them phase 4. And sometimes these studies are there to find new uses in new patient groups, in new combinations with other medicines. The timelines for development therefore vary significantly between maybe 5 years for your clinical development, for all the trials I mentioned, up to 8 or even 10 years. And once we've finished with these studies, we usually take almost 1 year just to look at the results and summarize the results and put together in the study report, which is the end product of clinical development. It's a clinical study report which runs over binders and binders, and there are tons of data in there, and we all submit this to the regulatory authorities for approval, and later on also to medical journals for writing up a more popularized summary for the benefit of everyone. That's the very long journey of clinical development and clinical trials.